Hey everyone, my name is Alexis Hunter and I am the Community Liaison for Wilmington Health. Today I am joined by some team members from Today's Care Plus. At Wilmington Health, we offer multiple locations for urgent and convenient care at Today's Care locations, but at 1202 Medical Center Drive, we offer an alternative to the emergency room. We accept walk-in patients of any age 7 days a week from 8 a.m. to 8 p.m. So let me introduce you to physician assistants Kyra Williams and Bill Rigsbee and clinical coordinator Deb Fizer. I'm going to let the three of them individually introduce themselves and give a little insight into their background and training.
My name is Deb Fizer, and I am a registered nurse. I am originally from Wilmington. I've been a nurse for a little over 25 years, and I graduated from East Carolina University. I have been an emergency nurse for most of my nursing career, either working in an ER or as a flight nurse, and then I ended up here at Today's Care.
My name is Bill Rigsbee. I graduated Wake Forest University PA program in 2005, where I received my master's in medical science. I received my PA certification through the NCCPA back in 2005 and my certificate of added qualifications in emergency medicine in 2014. Prior to joining Wilmington Health earlier this year, I spent the last 10 years working in emergency medicine at New Hanover Regional Medical Center.
My name is Kyra Williams, and I completed my physician assistant studies at Wake Forest University at Bowman Gray School of Medicine, and that was in 1991. And for the last 26 years have been working in the emergency room here in Wilmington, North Carolina, at all of their locations.
Bill, can you tell us the difference between a traditional urgent care and Today's Care Plus?
Sure, absolutely. Today's Care Plus is an urgent care that adds the ability to take care of approximately 90% of complaints that are seen in the emergency department. We can see and take care of complaints such as abdominal pain, nausea and vomiting, chest pain, trouble breathing, complex lacerations, even some orthopedic dislocations and complex fractures. This clinic is different in that we have ER-trained providers with years of ER experience. We can order lab studies and imaging such as CT scans, X-rays, and ultrasound, and have them done immediately without waiting, similar to an emergency department setting. We are also able to give IV medications, IV antibiotics, IV fluids. If patients require a higher level of care than we can provide at Today's Care Plus, we can get the patient directly admitted to the hospital, bypassing the emergency room altogether. Wilmington Health does have various specialists such as orthopedics, surgery, urology, OBGYN, and others that we can contact if we see something that is out of our scope. And like a traditional urgent care, we can take care of any typical minor or more than minor emergencies such as strains and sprains, simple lacerations, abscess drainage, rashes, urinary infections, earaches, and things like that.
Wow, that's really great. Thanks so much for that information. So Deb, why would a patient choose to come to Today's Care Plus instead of just going to the emergency room?
That is a great question too. One of the best parts is all of our providers are all true emergency trained providers, and they all have many years of ER experience, and they're very well respected in the world of emergency medicine. We're able to provide the same type of emergency treatment in all but about maybe 10% of the cases. We can do it in a fraction of the time it would take if you went to the emergency department, and we can do it in a much more relaxed environment. Not only that, but we can actually do it at a fraction of the cost as well. That's the best part. The nurses that take care of you when you come here are all very experienced, highly trained, registered nurses who are all certified to take care of the most advanced emergencies. They're assisted by experienced paramedics and medical assistants who all work together as a team to take care and deliver the advanced emergency care that we can do here. We have an in-house referral team. They're able to get all of the required approvals and the authorizations before we ever do any type of advanced imaging or diagnostic. So they deal with the insurance company on that level. No appointment is necessary. We're a COVID-free environment, and we try to remain that way by doing our screening at the front door. That 10% of the cases I was referring to a few minutes ago, of course, if someone has a severe trauma, an obvious stroke, severe hemorrhaging, a heart attack, that would be some of the instances you would want to go directly to the ER because they do have a cath lab and all the resources necessary to take care of that. But if you found yourself here in our department suffering from one of these types of things, we can facilitate and expedite your transport over to New Hanover and get you in the door pretty quickly and taken care of.
Great. What a wonderful alternative. So to piggyback on that, Kyra, if you determine that someone does need to be admitted to the hospital, what is the process for that?
Well, we're able to call the transfer center just like if we were at one of the outlying emergency rooms here in town. We would call the transfer center, speak to the Wilmington Health hospitalist, and we're able to bypass the emergency room. Sometimes there is the need to, the bed is not available to actually go to the emergency room, but we'd be bypassing the physician having to see them in the ER. So they're directly admitted to the hospital and do not have that additional charge of seeing the ER physician.
Absolutely.
So it works very quickly, very smoothly. We're actually able, most of these people, I'd say 90% of the patients that we've admitted to the hospital did not require an ambulance to go to the hospital, so they're able to leave from our area with their family members to go to outpatient registration and get admitted to the hospital.
Wow, that's so wonderful. What a great savings for our patients.
And it's just very quick. I mean, I've been, like I said, I've worked at ED on outlying hospitals from New Hanover to transfer our patients. That did take quite a while, but this has been extremely quick. I mean, usually the patients I've seen that had to be sent to the ER were admitted, they are gone within 20 to 30 minutes at the max.
Yeah.
That's a wonderful thing, and I'm so happy that we're able to do this and provide this for our community. So if you find yourself or a family member needing emergent care, we encourage you to come to Today's Care Plus at 1202 Medical Center Drive. Anyone who enters the building, just like Deb said, is required to wear a mask, and they have to have their temperature read as well as answer some COVID symptom-related questions. But you can learn more about Today's Care Plus in the description of this video, and we look forward to providing excellent care for you.